1990. Yeah, well, 10 years before that, Viagra was introduced to the market, and most doctors know then that Viagra works by concentrating the nitric oxide in the penile tissue, and as because of that, it managed to overcome one of the most difficult problems in general practice, erectile dysfunction. Before, Viagra was very difficult to treat, and we used a lot of this so-called behavior therapy, and it never really worked. And because of that, I knew about nitric oxide. I was skeptical initially. 2010, more than 10 years ago, I was skeptical. But to share the story, I then met a former colleague, much senior to me in age and much senior to me in practice, and he was a very respected physician in my home state of Kedah. He was chest physician, actually the state chest physician. And I knew him very well as a very delicate, very precise doctor, physician. He won't take anything lightly. He would want the evidence, and he would want that something to be really conforming to the science as he knew. But he was very passionate about this particular supplement providing nitric oxide, and he made me an offer. He said he was in fact offering me to go around to give public talk about the supplement, because when he was, despite his enthusiasm about the supplement, he found that his colleagues and his former colleagues, his colleagues then, and people that he has talked to, the doctors, they were not aware of nitric oxide. So he threw the challenge to me. Can you enlighten people about nitric oxide? And I literally was very curious, because this was a gentleman, a very precise doctor, very delicate, very meticulous with what he did, and he suddenly became so excited about nitric oxide. There must be something very interesting about it. So I did my reading, and as I said, this was one of the earliest books that I read, and I read, and then I tried the supplement for 2 months. After 2 months, I gave a public talk in Sungai Petani, attended by 4 people, 4 or 5 people. But apparently, I managed to make some impression, and that talk was about nitric oxide. And there was one GP. The rest were just our friends who actually was initially not interested in the idea. But from that, and from my own experiencing the positive benefits of taking the nitric oxide supplement, I journeyed on, and it came to the point where I spoke about nitric oxide in the parliament actually. And of course, initially I was condemned by a lot of people, because this is something which you don't discuss in parliament. But later it became a very big issue, and the food and nutrition became a very big issue, and nitric oxide also now is known to all the policymakers who initially objected to what I said. So I am today sharing, basically sharing what I have learned along the way during my journey, and I hope to learn something from the audience. And at the same time, I would like to highlight what I found most useful about the nitric oxide supplements I've seen, and in particular, my latest. I would like to say I would like to share my latest understanding, which has changed a bit about nitric oxide, and my latest experience with another product, nitric oxide supplement, which I think should be made known to the public, because it has been very helpful to me. And this nitric oxide, the whole story to me is nothing short of mystical. It has mysticism, and it has the spiritual aspect of it. My interest for a very long time has been about hypnotherapy, and later I learned that when you do hypnosis, actually you are preparing your body for optimal production of nitric oxide. And in fact, there are textbooks studies which show that when you are deep trance, your body produces nitric oxide, more nitric oxide, it goes to the brain. So it is everywhere. And later I found out that it is everywhere. And it answered a lot of questions that I have about chronic diseases, which previously there was no treatment, no effective treatment. And I think it's very exciting. And the latest exciting thing, of course, and last week, it was very clear that a nitric oxide nasal spray, NONS, nitric oxide nasal spray called Sanotize, is one of the most important modes of treatment for COVID-19 infection. There was a lot of discussion because they found it very effective. And that is also very interesting because when I was dealing with nitric oxide a decade ago, based on this book, we used to say that it is contraindicated in viral infection. Now it's different. It's totally different story. So let's begin with this slideshow. Is this slide? Okay. Okay. Shall I? Yes. Shall I point out to the slide? These are the 4 gentlemen to whom the credit of discovery of nitric oxide was given. And out of the 4, 3 got the Nobel Prize for medicine in 1998. Unfortunately, Nobel Prize is given for a discovery. Only 3 people are entitled to get the Nobel Prize. And the unfortunate thing is there were four people. So 3 people got, and 2 and 1 person in this group of 4 did not get the Nobel Prize for nitric oxide. So I'll begin with the person who was left out, Dr. Salvador Moncada. Dr. Salvador Moncada was from San Salvador, and later he became a citizen of British pharmacologist, but he has got a fellowship, honorary fellowship of the Royal College of Surgeons of England, and he was the only Latin American in the team. All of them, the 4 of them, each one of them discovered nitric oxide on their own. Meaning it was not a collaborative work, but each one contributed the same amount of research and efforts in discovery of nitric oxide. Dr. Salvador Moncada did not get the Nobel Prize, but he was compensated by the British government. He was given a Sir, I think. Sir, he was given Sir and some monetary, a lot of monetary compensation, and he ended up marrying a Belgian princess. Next one is Dr. Robert Furchgott from New York. Robert Furchgott has been researching a factor in the blood, which was referred to then as the endothelial-derived relaxing factor, EDRL. And he had researched that from the ending of the Second World War, very long time. And he himself was born in 1916. So he was a very senior fellow in the group. He passed away in 2009, Dr. Robert Furchgott. And Dr. Louis Ignarro is the most well-known and the person who was most vocal about the discovery of nitric oxide. And he wrote this book about his experience, No More Heart Disease. In YouTube, you can hear him speaking a lot about nitric oxide. Louis Ignarro is from UCLA, University of California at Los Angeles, a son of Italian immigrant. And he has got very interesting story how he became interested in the research for nitric oxide. And Dr. Farid Murad. Farid Murad is the third person in the group that received a Nobel Prize. Farid Murad, over here we will say Farid Murad. Farid Murad is American Albanian. The father was from Albania, a carpenter, poor family from Virginia. He's a medical doctor of medicine. Later he did pharmacology, but he did practice as medicine, and he's now Professor Farid Murad. The interesting about Dr. Farid Murad is that he is the man. He is the the person behind, the brain behind that particular nasal spray, the nitric oxide nasal spray, Sanotas, which has taken the world by storm because of its ability to treat COVID infection, and because in clinical studies it has been proven to be very effective in treating COVID infection. First 24 hours, it wiped out 95% of COVID virus in the nasal cavity, nasal and upper respiratory tract cavity, upper respiratory tract. And after 48 hours, 99.9%, which is very impressive with Farid Murad. About Dr. Luis Ignaro and Farid Murad, both of them have got their own supplement of nitric oxide. Luis Ignaro was working with Herbalife. Farid Murad was working with one company, after that another company, and his supplement also was marketed in Malaysia. And I did try both. I have tried both of their supplements to experience it. And and I understand that both of them have been in Malaysia. Farid Murad had spoken at UKM and he had spoken at IJN, Institut Jantung Negara. And that's the next one. So that's about the this is a slide which shows the certain things about nitric oxide. This is a normal blood vessel, endothelium. The endothelial cells. When I was medical student in the 80s, from 82 to 87, we know about endothelial cells in our class, histology class, but we didn't know its function. We could identify on the microscope, but we didn't know its actual function. It is actually a very important organ. In fact, we used to say that the biggest organ in the human body is the liver, but someone said, and in fact, Dr. Luis Ignaro said in his book, if we were to dissect out the endothelial cells and that line our blood vessels, the arteries, the capillary vein, everything, and spread it out, it will be the size, and for an average person, it's huge. So it is the biggest organ in the body. When it is so big in the body, and there must be a reason why it is so huge. The Creator, God, created us with so many endothelial cells and so huge organ as organ. There must be a reason. And now we know. Only now we know that it is the most important organ in production of nitric oxide. It is very important. Very important. We shall discuss about this later. But it's very important. And the failure of when we have problem with nitric with endothelial cells, so-called endothelial cells dysfunction, then we have problems, and we have many chronic diseases to start here with the failure of the endothelial cells, the endothelial layer to produce nitric oxide. Then that's for me amazing, because I didn't learn that in medical school. And this is about production of nitric oxide, the endothelial cells. Basically, this is later only I knew that this is one of the processes. There are two processes of nitric oxide is produced in the body, but this is the usual process that we refer to, where the endothelial cells get L-arginine, the amino acid L-arginine and L-citrulline. It goes through the cycle and it produces nitric oxide using enzyme, nitric oxide synthase, and from the substrate, from the raw material of L-arginine, using the enzyme, nitric oxide is produced. It goes into the blood vessel and it's taken all over the body, our body. The interesting thing is this. This is actually the basic life process in our body, in human. We cannot survive without food. It will take us 3 or 4 days before we die. Without water, it will take, they say, around 2 days to 3 days, 2 to 3 days, 2 days maybe. Depends on the ambient temperature, then we'll die. Without air, maybe 10 minutes, then we lose consciousness, then 50 minutes, irreversible damages start taking place. But without nitric oxide, even for a second, nothing works. The heart stopped pumping, and the brain stopped thinking, and everything is dependent on nitric oxide. So it is actually very important, a very important factor, and a very important reason for us why we are healthy and why we are sick, and it's very critical component of health, nitric oxide production. So this takes place in the blood vessels, so it's very important. And I said, uses nitric oxide, but it is not exogenous nitric oxide, meaning nitric oxide doesn't come from outside. It concentrates the nitric oxide already in the penile tissue by using a pathway. This is just to mention the technical pathway, cyclic GMP pathway. So it concentrates, but it concentrates only what is available. But nitric oxide supplement will be giving exogenous nitric oxide from outside to the body. It's slightly different. But this is the first eye opener. And in fact, nowadays you talk to some doctors, you mention nitric oxide, what they think is Viagra. It's interesting, but we'll come back to that. And this is human body, and there is not a single organ or single area of the human body where nitric oxide is not used. Everything is using nitric oxide. The brain, so many. The memory, the processes of thinking, memory formation, everything is dependent on nitric oxide. It is a signaling molecule, and it is needed for all the life processes and the processes of the body. And the other thing is, it also when you talk about bony structures also, nitric oxide is the compound that is the reason why some bones are stronger than the others, for example. It is very important for everything. But of course, 10 years ago, when I was first introduced to nitric oxide supplement, we were talking about nitric oxide being vasodilator and being a cardiovascular system, cardiovascular system, nutrient for cardiovascular system. Interestingly, during this pandemic, it has changed everything. Not to say change everything, but people are talking about nitric oxide as antiviral, antibacterial, antifungal, antiparasite. I was following the discussion in India because they say that the answer to Indian problem is nitric oxide nasal spray, because it's very easy to give, no side effect, and people can administer themselves, and the Indian hospitals are congested, so give nitric oxide spray, it will take care of a lot of problems. So interestingly, it is for everything, it seems, and that is the reason why I think God created it in such a way that we have the biggest organ, and it's also very interesting because body will come down drastically, and you are a candidate of heart attack, for example. So you are good, you get more. You are bad, you conduct yourself as an antisocial, as a psychopath, then nitric oxide level will come down, will less. And you do meditation, you do prayers, you do zikir in Islam, because zikir, remembering of God. You come down, and then you like the monks of Tibet, for example, they do the humming, and you concentrate they concentrate nitric oxide in their nasal cavity, and it goes all over the body. They're humming, interesting. There was a study, scientific study. Then the nitric oxide level is boosted. So that is something which as I said, it's almost mystical to me. It's just needed everywhere, and it's given free of charge, provided you are good. You are bad, and you are an enemy to the society, real enemy, not a political label enemy. Then you are then you have the problem of your life is shortened because you have less nitric oxide. And one of the gentlemen that I read about and later I met when I was researching nitric oxide in my early days was Dr. Joseph Prendergast. He's a very interesting man, and I got to know about him, and then he gave me this book, Dr. Joseph Prendergast. This is The Uncommon Doctor, written by him about his experience. And the interesting thing is this: when he first wrote part of this book, he didn't know it was nitric oxide that helped him. He has a very interesting story. This was in Bangkok, 2012. I participated in an international conference organized by the maker of the supplement that I was taking then, and this was me in 2012 with Dr. Joseph Prendergast. He was telling his life story. Joseph Prendergast was an endocrinologist. He's an endocrinologist. When I met him, he was 75 years old, and at 37 years of age, he had some chest complaints, chest pain. And later it was investigated. It was found that he has got marked atherosclerosis of his aorta. And that was due to genetic problem because his father, Prendergast Sr., was also one time a famous doctor, had stroke and later died of stroke at around 40 years old. So when he was 67, it was discovered that then, of course, there was no MRI and all that, but it was discovered that he has got very big calcification of his aorta, and it was a time bomb going to explode anytime. But he was already an endocrinologist, and he said, if someone could treat this condition, it should be me, because after all, I'm an endocrinologist. And he discovered that he didn't know about nitric oxide, but he discovered that if you take from many studies, experimental studies, my studies, and all that, that if you take L-arginine, somehow it reduces the size. He had reason to believe it will reduce the size of the calcification, and he began taking L-arginine, 500 milligram twice a day, something like that. And after some time, he felt better, no more complaint, and he wrote about experience very well in this book. He then went to see his radiology friend who had the initial film they had about his atherosclerosis, and from something like this, which was the previous film, I saw in last time it was available over the net, image of that. There was X-ray as well as other more primitive method of imaging. This is the era before CAT scan was widely available. Then now, when they did again study and then they used CAT scan, it was completely clear. He was very surprised. Something has happened, and it has never happened before. In the history of medicine, from a condition like this, where you have a lot of calcium, you're practically walking time bomb. You cannot go back to normal, but it was go back to normal. He had reversed his condition. And then much later, in 1998, before 1998, he only knew it was because of nitric oxide. And I also read about the writings of Victor Zhao, who's the guru of cardiology. Any cardiologist will have to read his writing to pass, and the John Cook, not enough time for me to quote everything. But they were also talking about endothelial relaxing factor, which is later nitric oxide. And they were talking about the role of nitric oxide. In fact, Victor Zhao devised some stent to be put inside when you do stenting. A stent, part of the stent will be left inside and keep on producing nitric oxide, and that will prevent a recurrence of the atherosclerosis. Victor Zhao was very positive on it, and because of that, I was very convinced about the role of nitric oxide in the cardiovascular system. And Dr. Joseph Prendergast later was given this particular award. He was the American Diabetes Association Father of the Year. I think it was 2000. It was 2008 or 2009 for a single achievement. for a very unique, most singular achievement. He was the endocrinologist who treated, he was a diabetologist, he treated diabetes, follow-up diabetes patient, but his referral rate, no, his complication rate was less than 1%, meaning less than 1%, of his patient had any diabetic complication. And he achieved that by giving L-arginine, nitric oxide, and he achieved that, that's all. In fact, he said when he began practicing, before he used L-arginine and nitric oxide supplement, he used to refer 30% of his patients to the cardiologist to do stent, to do bypass, and for other things, and also kidney failure, renal failure, hemodialysis. But after he started using nitric oxide supplement, which he himself formulated, after a while, he had less than 1% of his patients who ended up with complications. It was very remarkable. And on hearing what he had done, there was another doctor called, his name was Dr. Siva Arunasalam, and he is a Malaysian. No? He was a Malaysian, I think. No, he was a Malaysian. He went there, very young man, studied medicine and stayed there and became a cardiologist in California. He founded an institute called High Desert Heart Institute. He knew of what Dr. Joseph Prendergast did, and he wanted to test. He got his patients who were on maximum medication for heart. Patient has got pulmonary hypertension, heart failure, ischemic heart disease, coronary artery disease, and some patients who cannot be discharged. There was one very famous person, very famous patient. His name was Angelo Chichi, who could not be discharged. Outside the hospital, he became breathless. So he got them. He continued their medication, already maximal, most of them maximal on antihypertensive, on nitrates, everything maximal. And he just added a nitric oxide supplement that was by Synergy, and it was pro-arginine. And he was surprised with the result. 18% increase in HDL, 40% decrease in triglyceride, 8% glucose reduction, 35% decrease C-reactive protein, 11% reduction creatinine levels, 35% increase in magnesium level, even though there's no magnesium, decrease in platelet, everything. And the patient also clinically improved so much. Diastolic pressure decrease, systolic pressure decrease, peripheral blood flow increase to the feet, ankle, caps, central aortic systolic pressure decreased by 6%, pulmonary hypertension dramatically improved. Like that man, Angelo Chichi, you can get him his testimony and his experience. And in fact, he used to follow Dr. Siva in his speeches, how he could be discharged very well, and he could lead normal life after being in hospital as a gone case, waiting to die. So the quality of life improved. So that was very remarkable, and I was very impressed by the study. And this is what Dr. Siva said. I expected a marginal improvement. Oh, we have to correct this. Improvement in the symptoms. What we ended up seeing was remarkable. Positive remodeling of the heart, positive pulmonary artery changes, pulmonary vascular changes, everything. And Dr. Siva and Dr. Joseph Prendergast, this was the first
Yeah, why no sound?
Organizer, please check there is no sound. The speaker, please unmute yourself.
Hi everyone. Sorry about this technical. Dr. Azman is going to lock out and lock in a short while again. Yeah, just be patient. We should be able to sort that out. Yeah. Thank you. Hai, sudah login? Tak ada suara? Ada? Sudah unmute ke? Is
Okay.
Yes.
Done.
Yes. Okay.
Okay.
All right.
Okay, lah.
Go ahead.
And then
Okay.
now I start sharing the
Screen.
screen. Moment.
Oh, dia berapa?
Okay.
Macam telefon saya, plot nama saya.
Oh. Hello, nampak tak slide?
Backtrack a few slides.
Okay.
Gangrene.
Okay. We do. Okay, start with the.
Okay, thank you. So jadi ni Pak. Yeah, sorry about that. Can you see me now? Can you move this one here?
Oh.
Can you see me now? Yes, screen sharing and then do off. Just I want to. Oh, yeah, wait. Saya fikir ni enggak?
Okay.
Huh? Can you bring me here? Jadi. Bila? Okay. The rest, yeah. Okay. The rest tu bang. Okay. So is it okay? Can you see me? Can you delete it? Is it okay? Can I continue?
Yes, Dr. Azman. Yes, we can.
Okay.
We can.
Yeah, we have to.
You might want to backtrack a few slides, yeah, because
gangrene is a slide now.
A few more slides, I think. Yeah.
A few more. Backtrack.
Okay.
Yeah. Okay. All right.
Yeah.
Okay. Thank you.
Sorry,
everyone. Yeah.
Okay. The study I mentioned, so-called high desert heart institute study, and this is the next one about gangrene. Did you get to hear what I said about gangrene just now? No, didn't. Okay. I go back to this is Dr. Siva Salam and Joseph Prendergast and the High Desert Heart Institute study. Did you get this one? I mentioned about the study. No.
Or why don't you start? Why don't you start from there? Yeah, that'll be fine.
This one the study.
No. Just yeah. Yes. Yeah, this one. Yes.
Yeah, this one. Okay. So this study actually was very interesting because it shows that nitric oxide supplement does have a role in patients who are already being treated and still are not well. Because it's very common. We give a lot of medicine for patients, but they still do not improve. So you can add on nitric oxide and it does have an effect. And this was eventually, this is the Dr. Siva Abdul Salam's words himself, that he himself was very surprised, very amazed by what happened to the participants. They improved so much their life, and also where the parameters of improvement were seen. It was very remarkable, and I was convinced by that. And in my practice, this was one of the earliest condition that I used nitric oxide supplement. It was gangrene. Usually diabetics have got this, and this is the so-called peripheral blood vessel disease. The blood vessels basically are not functioning normally. So you have this is not because of germs, but because the blood is not flowing normally. The blood vessels are diseased. So I found that when I give nitric oxide supplement that I was using then, the improvement was very remarkable. But because the time is quite short, I go straight. First, the other thing, Mr. Nicholas, can you just tell me whether it is possible to add a few minutes the injury time? Because we have missed.
Boleh. Don't worry. Take your time. Take as much time as you need. Yeah? No worries.
People are not fasting, but I'm fasting. I'll take much later. So okay. So this is one of the conditions which I found very remarkable. when I started my practice in Penang in orthopedic in 1987, a lot of these ended up with amputation. And I found that with nitric oxide supplement, I managed to achieve something which I never thought possible. And as a result of that, a lot of patients were very thankful. And there's a doctor here whom I taught how to use nitric oxide supplement just for this condition. And she became very famous. People from as far as Perak and 200-300 miles, 200-300 kilometers away came for treatment when they have got gangrene. And this was achieved by using nitric oxide supplement only. And I have treated patients just using nitric oxide supplement, no other medication. And they continue other medication, and they're still walking around now, very happy. One lady whom I treated, and she absconded from hospital, was due for amputation. I used nitric oxide supplement and coconut oil, but it was nitric oxide supplement that helped her. She just passed away because of other illness recently. And I treated her in 2013. So it was more than 7 years. So it's very, very remarkable. The other one is a patient with renal failure, kidney failure on hemodialysis, or about to go for hemodialysis. And when I gave nitric oxide supplement, and they started improving. And those in hemodialysis who have not passed urine for 2-3 years started passing urine, and they're very happy. We pass urine all the time and every day, and we are not so thankful. But these people have not passed urine, and sometimes they dream of passing urine. But when they took this nitric oxide supplement, it helped them very much. But there was a great difficulty because many of them are on fluid restriction, and the particular supplement that I use, you need a lot of water. You need to reconstitute 250 ml. So it's very difficult. You have to start little over there. I'm coming back to that. This one improved. And this is my experience in Kuala Kedah, where I ran the clinic, ischemic heart disease. There was one patient which I put in YouTube, very hard to find because so many videos now. He was due for stenting. He took the supplement, and when he went to check back, he felt so good. He went and checked, and he was normal. He was normal, and the cardiologist told him no need for a stent. He was very happy. And hypertension, of course, hypertension is high blood pressure anyway, chronic high blood pressure, so bring down chronic ulcers, diabetic gangrene, bronchial asthma, because nitric oxide is also used by the lungs for lung function. Erectile dysfunction, yes. Sometimes even they take Viagra, it's not working very well for some reason. So you add on, they are patient. And the other thing is sometimes they need one tablet of the Viagra with nitric oxide supplement. They can take only half. Memory loss, yes. Irritable bowel syndrome and post-stroke. It helps very much after stroke for patient to recover, and sportsmen. These are my experience last time. There are other indications after that. And now, of course, we know it is also very good antiviral, antibacterial, antifungal, antiparasite. But I haven't used that. And this is very briefly the pathway that when we use that particular, most of the supplements in the market, when we use, it goes through this pathway. You give L-arginine, it goes into this cycle, urea cycle. You couple with L-citrulline if you want to perpetuate the cycle, and from there you produce nitric oxide in the cell, from the cell. So this is one way. But later, not too long after I used this, I discovered something else. This is Tengku Razali Hamzah from the Parliament. Yang berhormat mulia Tengku Razali Hamzah. I think politician like me will know him. Younger politician may not know, like our Buang, Syed Sadiq, 37-year-old. Don't know him as a person in long time ago in the 70s and all that. He was claiming then about the time that he is healthy and he's still able to perform. And of course, recently he offered himself to become Prime Minister, and he gave that credit to taking noni or mengkudu. This is something interesting, mengkudu. And what happened in mengkudu? Mengkudu or noni, much later, I discovered the mechanism, the pathway. Mengkudu has got a lot of nitrates. Mengkudu is one of the nitrates-rich plant. Every part of mengkudu, from the fruit, from the leaf, from the bark, from the shoot, everything has got nitrates. And the Malays have been using this as supplement and medication for a very long time. And Tengku Razak Hamzah attributed his help and his ability to be re-elected again as a member of parliament, perform as member of parliament because of Mengkudu. That is very interesting to me, and that to me is not just interesting, it is also fulfilling something else in my family. I'll come back later. This is Noni. For those who do not know, in Pulau Kedah we have got a lot of this by the seaside, and then people, you just pluck this one to throw at goats coming to their compound. We've got a lot, but this is a wonderful fruit, and this is a Mengkudu. Apart from producing nitric oxide, it has got a lot of other things, antioxidant and whatnot. But most of these attributes, most of these benefits of Mengkudu actually come from the fact that it's used by the body to produce nitric oxide. And interestingly, this is the second pathway which is becoming more important as we grow older. Because the first pathway of L-arginine coming into the we take anti-arginine coming to our body, it goes into the bloodstream, it goes into the blood vessel, goes to the endothelial cells. Endothelial cell will produce nitric oxide. But as we grow older, this particular pathway becomes less and less efficient. Many reasons. So if you are 40-year-old and above, that pathway is only 40% effective compared to when you were in your 20s or 30s. It's becoming less and less effective for many reasons, and one of the reasons is because as the blood vessels grow older, the endothelial cells also are functioning less efficiently. But Mengkudu is different because Mengkudu and the nitrates-rich plants, Mengkudu, beetroot, and many other things, nitrate-rich bayam as well. When we consume that, the nitrates is converted to nitrite by the good bacteria in the oral cavity, especially around the tongue, in the fissures of the tongue and all that. That converts to nitrates to nitrite, and that nitrite is converted to nitric oxide, through the action of the gut as well. And that is more important. And that is what I have to say. I'm not here trying to endear myself to Mr. Nicholas Tan by saying this, but I was very surprised that when I was introduced to Nitro FX, it worked so well in me. How do I know it works so well? Because it positively affects my sleep. I had a very good sleep, deep sleep, and I know because I managed to complete all the sleep cycle, the non-REM deep sleep and the REM, rapid eye movement phase of deep sleep. And I knew this was something as remarkable as my first experience when I was much younger, 10 years younger, with the L-arginine. It was very good. And the other thing is, how do I know that a supplement of nitric oxide works? Just briefly, Mr. Nicholas Tan, can we continue? Fine with me? Okay. How do I know? And I tested with Nitro FX, and I was surprised. Number one, my blood pressure. I am one of those people, actually many people are like me. When we wake up from sleep in the early hours, if we take blood pressure will be high. And that is called the express stream by some people. And that's the reason why the surge of blood pressure before we wake up can go very high. And in some people that leads to stroke and heart attack and all that. Stroke and other problems and the bleeding for people who are high risk. I am like that. I can have a restless night in the parliament, and then my blood pressure will be 140/90 immediately upon waking up. Whereas my normal blood pressure is around 120, 120/70, 120/80. And later, much later, because of a few things, my blood pressure came down to 110 or 70, which I love it. But still, before taking Nitro FX, when I wake up immediately like that, it can go, if it's a restless night, I did not get much sleep, much rest, it will be 130, 120, 135, 140, and later it will come down. After I perform my prayer, it will come down to normal. But with this Nitro FX, even though I don't sleep well, blood pressure maintained. So that is for me one indication. The other one that I know, and the other one is I get restful sleep. And if I dream also, it's not nightmare, it's restful. It's relaxing, come back, and I feel fresh, very fresh. So that means the concentration is high enough to affect the brain. The concentration can be high enough for erection, but not the brain. The brain requires much more concentrated, much higher level of nitric oxide. Number 3, of course, this is being frank. I monitor with early morning erection. And early morning erection is very important because studies have shown if you have weak early morning erection, that is associated with higher risk of having stroke and heart attack. Stroke, especially stroke. Many papers show that because it shows poor circulation, and this one gives very strong early morning erection. So I know this is particular and remarkable. And I am now, because of that, I am not to say persuading, but I would recommend someone who's like me, entering 6th decade anytime, or at the end, or after 40, should be utilizing this pathway. And NitroFX has done very well. I'm saying this sincerely from my heart, and I have tested around 10 nitric oxide supplements, available initially and not available, to the point that my 10 or my 12 bottle was blocked by the customer because there was no permit. There was a citrulline and all that, but claimed to be very good. But I know that this particular one is very interesting. And the other thing that this one works, the other thing about NitroFX, I will say here, just for information, if you have someone who is going to have renal failure, and that someone will benefit from nitric oxide. My other supplements have problem because you have to reconstitute that with a lot of fluids, and they are on fluid restriction. But this one, very little fluid. For that, I would like to congratulate everyone at Kiani, because you managed to get the nitrates concentrated just 1 ml, and you can have the effect. And even people with gangrene also, when they are on fluid restriction, they cannot take much fluid. They can take only 500 ml per day. We have problem. But with this one, it's very remarkable. And almost magical, may I add. And the other thing is, this is my grandmother. She passed away in 1961, a long time ago. And for me, the personal fulfillment of her wishes, she wrote a lot of messages and notes and letters, and until now we can discover she was a copious, prolific writer to the children. And one of the things that she kept on stressing was for us, her descendants, to consume noni, mengkudu, for good health. And it was reported that she was in good health. This was one of her last photos, and she was then nearly 80. But she was in good health, and she attributed that to mengkudu. But of course, we didn't know nitric oxide or whatever. But she
Hi everyone. Sorry, the thing hang again. Dr. Azman is going to log in again. Yeah. Just a minute.
Okay. Okay. Is it okay? Can you hear me now? Okay, thank you. So yeah, I just trying to wrap up. Okay, this is Kenny. Yeah, I think it's fair to just conclude, just come to the question, because you promised that this is the last slide, unfortunately. Shall we discuss now?
Okay.
Shall we attend to some questions?
Yeah. Thanks, Dr. Azman, for wrapping up and sharing a few key points. While Jermaine, I will stop your sharing, and then Jermaine will put up the questions. Yeah. Sharing of your slides. Yeah.
Okay.
Yeah. Doctor, thank you so much for highlighting the importance of NO, where you mentioned even within seconds we do not have NO, it's like we will die kind of thing. NO is like no laughing matter, huh? And I like what you say about FOC from our creator, and when we are good, when we are calm, we are forgiving, when our happy, our NO will increase. That's very interesting.
You are forgiving as well. Forgiving.
Yeah, forgiving. Correct. That's so interesting. Huh? Forgiving. That's a good point.
That is proven. Clinical hypnosis, we know that. You're forgiving, then you have freed yourself for NO production. That's why people who forgive and forget. Then they wake up and they can smile. The others will suffer heart attack.
So important, huh? But I like also what you talk about, the importance of nitrates and nitrites pathway, huh? I think that's really very powerful when you talk about it and how it's relevant to us. Let's look at the questions. Yeah. The first question, Jermaine, could you, can nitric oxide for people who is tested for urine culture and have a trace of occult blood, this person have a history of kidney infection since at a young age, but it's okay until just recently after 50 years of testing this urine culture, this problem arise again. Can you see the questions?
Yes, I can.
Okay, then go ahead. Yeah, please proceed.
I see no harm in taking. That there may be a reason for this occult blood. It has to be investigated. But even if it is a tumor, for example, occult blood, usually we are worried of tumor. We are worried of chronic infection. Nitric oxide does have a role. Nitric oxide is anti-infective. If there is infection, it helps to clear off. And at the same time, if there is a tumor, it is anti-tumor as well. It's our body's part of our body's natural immune system. So can be used, can be taken apart from the conventional treatment. Yeah.
Okay. Thanks. The second question. Yeah.
Can be used for people chronic kidney disease. Yes. Kidney disease is basically caused by disease of the glomerulus, or the filter of the kidney. And glomerulus is a collection of blood vessels. Blood vessels in the back, that is the glomerulus. And this blood vessel, it has got endothelial cells and everything. And that we know that for a fact that nitric oxide, we have got a lot of scientific references. Nitric oxide does improve the health of the endothelial cells. It does make the blood vessels healthier and functioning. And for that reason, at every stage of kidney disease, nitric oxide helps. It helps to get more nitric oxide, apart from the treatment that has been given. For asthmatic patient, number 3, what dosage to consume? I would say you try the usual dose, which is if adult, we give 1 ml twice a day, right? So twice a day. And if the response is good, some people respond very well with the previous one that I used. And some people will need higher dose. So maybe the certain time of the year, they have more for many reasons, weather and all that, they have got more asthmatic attack, then increase it to 3 times a day, 1 ml 3 times a day. Can kids take NO? Yes, kids also do. Interestingly, I asked that question to Dr. Prendergast. He said in America, the newborn also, I gave a bottle of nitric oxide supplement, and they're very well. He's an endocrinologist and he studied the issue. Maybe slightly later, because our body can adjust a naturally occurring molecule. Our body knows how to handle, because we use nitric oxide in the body. If it's excess, it knows what to do. You give medicine, it's different matter. Medicine manufactured in the lab by Pfizer, it doesn't know. The body doesn't know. There was no Pfizer when we were designed, so it doesn't know. But if you give it to our body, something natural like nitric oxide, it knows what to do with the excess nitric oxide and stuff. Of course, you can give half of the adult dose for kids, for example. They may not need so much. They don't have hypertension, diabetes, and other issues. What is half-life of nitric oxide? That depends very much on the pathway. This is very the half-life of nitric oxide as a gas is very fast. It's less than 1 second. But you perpetuate it through the cycle. When you give L-arginine, you use L-citrulline to lengthen it. The one that I showed pro-arginine, for example. The half-life is around 3 hours, I would say. But with L-citrulline added, it goes longer, 6 or 7 hours or 8 hours. We know how do we know its efficacy? We saw it. It reversed gangrene. It reversed atherosclerosis. We have seen the result. And of course, it improved patient with kidney failure. And the high desert heart study, for example, a lot of the people who have been on maximum medication for heart problem, and they still have the problem. When they are given the nitric oxide supplement in the high desert heart study, the detailed results are there available. They really improve. You just type Angelo Cicci testimony, A-N-G-E-L-O, Angelo, is of Italian descent, CICI, Angelo Cicci. He had pulmonary hypertension, it improved. And pulmonary hypertension, for example, one of the treatments is Viagra, because nitric oxide is used for treatment. So it does improve. It does improve. To be more exact, Dr. Siva Salam can answer. He has got the detail. He does the measurement. But having said that, we have more than just one testimony where so many people who I've seen in my practice, people who improve with nitric oxide supplement, including learning ability increases. Number 6, how do you counter some side effects reported from internet? Noisy breathing, blood urine, low blood pressure, collapsed lung. No, I don't see that. The only problem is migraine. Some people have got migraine, and when they take extra nitrate, they have headache. That is very common. And these people, you just give a low dose first until they tolerate that dose, then gradually increase. Then you see no problem. They know, and they have migraine with a lot of things. People who have migraine, they have a lot migraine with a lot of things, not just medication, a lot of things, weather and all that. But you use a small amount first, and you increase gradually. Usually they can tolerate. It may damage brain cell, literally. No, that's nothing. It can be used to treat Parkinson and some Alzheimer's improve. Huntington disease, amyotrophic. It doesn't damage brain cell. There is no evidence whatsoever. No reason to think, because it is a natural substance which our body used to repair. It's a repair molecule. I think that one comes from just like all the other, a lot of things in the internet. A lot of things. There are a lot of things which are not based on anything. It's just somebody typed. That's all. Low blood pressure usually is not a problem with the supplement. It's more with medication, because as I said, a natural molecule, our body knows how to handle. So if the blood pressure is very low, no. That particular physician, consultant physician who introduced me to nitric oxide supplement, his blood pressure was 110/70 or 110/60, like my blood pressure now. But he said when he took the supplement, he had less giddiness. It won't go further. Medication will do that, but not supplement. It works differently. Our body handles supplement differently. It is something natural to it. It knows how to handle. Number 7, I have an elderly doctor friend who is suffering from Parkinson. Yes, from Parkinson, you can try. May I also recommend you introduce this one first? And the other thing is, of course, coconut oil will help. This is the science is very clear. You can try Parkinson, but there are other things as well. Other nutraceutical apart from nitric oxide. Is NO supplement safe for all conditions? I would say so. Yes, supplement is safe. Any contraindication? Can anyone take arginine? Yes. I don't see any contraindication if it is just supplement. If it is in the form of medication, because the pathway is different, the way it is presented is different, like Viagra, then there are some contraindication. But supplement is different, and supplement is actually food, which has an effect, nutraceutical. I see so. Last time we used to say the contraindication is viral infection, herpes zoster, but now it is established to be antiviral. So we used to say, is there any contradiction? Yes. If you have viral infection, don't take. You have very bad runny nose, don't take. Wait until you recover. Now they say you have COVID, you take. so it's that's how. But naturally, so logically, this is what our body uses for its immune system and all that. So there's very little contraindication. Can anyone take arginine? Yes. And in fact, it's given for burns last time. Number 8, 9, do we experience what kind of dosage? What kind of dosage should recommend dialysis patient? I would say NitroFX, you start with low dose, 1 ml, and for 1 ml for 3 or 4 days. If the patient feels quite good, feels some better sleep and all that, then you increase to 1 ml twice a day. Then then within a few days, you go to maximum 1 ml 3 times a day. Within a week, you go to 1 ml 3 times a day. For patient with the pro-arginine, which I used a lot for this last time, we started very low because of fluid restriction. When they started passing urine, then we gradually increase. And then they can reduce their hemodialysis frequency, for example. So I would say with NitroFX, I would say 1 ml, maybe a week, and see whether they improvement. Then increase to 1 ml twice a day. And if they feel better and they feel like passing urine or they start passing urine, then you quickly increase to 1 ml 3 times a day. And for example, for gangrene, I will use the maximum 1 ml 3 times a day or 4 times a day even. There is very little danger of that. The gangrene will kill them. But I have seen, I would say, gangrene, they respond within 24 hours. So much so, I have felt very irritated because they come in a wheelchair. And other patients could understand why they went in first. Tomorrow morning, they come walking with sunglasses and they walk in straight, and people are very, very unhappy.
Okay, any other question? Dr. Azman, are we still connecting with you? I'm not sure whether the line is hang. Can you hear us, Dr. Azman? Just hold on, ladies and gentlemen. I'm trying to connect to Dr. Azman. Let's see whether what happened just now. Hold on.
Yes. Can you hear me now? Sitan, can you hear me? Okay.
Yeah. Okay. Now it's good. Yeah. All right. Sorry. We take this few more questions. Jermaine, any more questions? A few more before we end.
Yeah. We are here. I'm 62 years old. My heartbeat.
Yeah, Dr. Azman, number 10, please.
Yes, number 10. My heart, after taking TOH, what is TOH? After taking TOH.
TOH is a triangle of health.
Oh, okay.
Yeah.
Yes, then it's working. It's working. Then it's working. 120 is you have tachycardia. There are other reasons, but now heart is normalizing. 90. That means it's responding. I would say that is a good response, positive response from the triangle of health, which includes nitric oxide. What are the vegetables or fruits that have high level of nitric oxide? I know noni very well. There is also beetroot, we know. I think bayam has got, spinach has got that. What else? Offhand, those are the few that I know, but there are a number.
How about kale?
Kale as well. But nothing compared to noni, if you ask me. Okay. I'm a bit prejudiced in that because my grandmother, for example. But I have done some research even before this, and that is also what Kuli Tengku Razali Hamzah said. He has tried other things, but it's noni that works very well. Can a senior citizen, age 93, have high platelets count of 2,000, 4 times the normal thick nitric oxide? Yes, no problem. And in fact, one of the functions of nitric oxide is that that 2,000 means it's not high. Platelet is 150 to 400,000, for example. 4 times. Sorry, this is different unit. 4 times more than normal. You can. It has got an anti-platelet and anti-platelet. Nitric oxide naturally is anti-platelet in the sense that it prevents excessive bleeding. It prevents pathological bleeding. It can be taken. Importantly, I know can take warfarin. It's okay. Okay. Warfarin is a bit of a problem. Warfarin. I would say that if you want to take, if you are taking warfarin, I wouldn't recommend nitro extreme because there are more things there. Just nitric oxide will be all right, but you have to maintain the dose. You maintain the same dose. Say you take 1 ml twice a day, then you maintain that, and you go and check your warfarin, check warfarin, check the blood. What do they call it? You check the bleed. There is a test that they do to see whether the warfarin is national. I've forgotten the name in the parliament for 8 years. But you go and check. But if you maintain the same dose, I think it should be all right. But not extreme, because there are many other components there that may affect warfarin. Nitric oxide alone will be all right. But you have to be consistent. You keep on taking the same amount. You say you take 1 ml twice a day, then continue taking that. and of course monitor if there are bleeding tendencies. If there's none, then you go and check regularly for a while. Then if it is acceptable, you're within acceptable limit, INR. If INR is within acceptable limit, then continue that particular dose. But not too many supplements, because if you want to use supplement, take one at a time for when you're on warfarin. Nitro Extreme has got a few other things in. It's very difficult to measure. It is best that you take Nitro FX only. Does nitric oxide help in vertigo? There are people I heard they have improved because after all, vertigo also there are many causes of vertigo. But one of them has got to do has got to do with blood flow to the brain also. When you normalize that and you maintain a steady blood flow to the structures in the brain, it does help a bit. Can try, no problem. Can try. And it's just people who have told me that their symptom of vertigo improved after they took nitric oxide. Can cancer patients still under chemotherapy? Yes. Cancer patients, yes, they will benefit from taking the TOH, the triangle of health, which are supplements. They do help. They do respond. All these things, and in fact, when you're on chemotherapy, the body is under great stress. It needs more vitamin C. It needs more B complex. It needs more antioxidant to help it. That should be very helpful. Any benefit for autism kids? I do not know. Number 16, I don't know because I've never tried it. Autism kids, I don't know. But if there is some study or some people with experience, I will communicate to Mr. Nicholas Tan. And inshallah we'll know. 17, may I know when to take warfarin? It's okay or anything? Again, the same answer. 17. I would suggest if you are on warfarin, start by taking Nitro FX only first, and you can take any time. But preferably you take at the same time of the day, same time in relation to warfarin. If you take warfarin first, you don't have to wait. I think I should wait half an hour is okay, or you take half an hour before or half an hour after also is okay, but make it same time every day and same the dose of the warfarin and the Nitro FX make the relationship same constant. You can take before or after, but make sure that it is every day before or after, and then you go and check your INR. But if the INR is acceptable, then continue. Nitro Extreme, you can try later. After you are stabilized, then you can try Nitro Extreme later. Then if you find it well, it doesn't disturb your INR, meaning your bleeding tendencies are normal and acceptable, then you can continue. Then fresh noni fruit, yes, you can take fresh. That was what my grandmother used to do every day, almost every day. Whenever she had access to noni fruit, the fully ripened one is very nice to take. In fact, I like that, except for the smell. But the very ripe fruits usually are not that smelly, and they are very nice to take, very tasty, in my opinion. Why some people after taking Nitro FX they feel tired? That the initial reaction when you just take Nitro FX or nitric oxide, just like some other supplements, strong supplements, your body will move into a new set of metabolism. It's a different metabolism altogether, and your body is adapting to that particular new parameters. That is called the healing crisis. You can feel tired for a while, but that should not last very long, and after that you can start having the benefits. Some people will have pain also because they have old injuries, for example, and now blood is flowing there and they have quite a lot of pain. Feel tired also can happen initially. This is seen in some supplements as well as some medication, but it's not to be worried about.
Okay. Wow. Thank you so much, Dr. Azman. You have covered so many questions. I think important for us to understand that taking nitric FX and all that is a supplement. It's not it's a
not
treatment field. I think we have to be very clear about that. Yeah, but the way you share, and I think your own experience, I think when you take the pathway nitrate to nitrite, that's amazing. Really so encouraged to see how that has helped you and so many people. Thanks so much, Dr. Azman. I know this is Puasa month.
Sorry for the interruption.
And really appreciate, and so many of us are locked in today, and we really appreciate that. You know, is there any you want to wrap up? Any comments?
No problem.
Yeah?
Huntington, no problem. No problem. Chronic diseases.
Okay. Anything you want to say before we wrap up?
Can I say a few things? Yeah, thank you very much for that opportunity. Number one, I think nitric oxide is a very special molecule. It's not ordinary supplement. This is a basis of life. Life exists because of nitric oxide. That's number one. We are created with it, and as I said, it's given free of charge by our Creator, God, and we should be thankful for it. And you see that when we live in harmony with nature, harmony with others, and harmony with nature means we are dependent on the goodwill of the good bacteria in our mouth to produce nitric oxide. So that should be the way we live for the rest of our life. Should be in harmony. And for that, I would like to remind everyone that we have to take care of our body, but part of taking care of our body is we take care of the good bacteria in our mouth. So be careful about using very strong mouthwash, like Listerine, for example. I have to apologize to this group to mentioning a brand. A very strong mouthwash, don't use. You get rid of now we know that you cannot get rid of the good bacteria in your body. And in the mouth is very important, very critical, because you need them for production of nitric oxide. And because of that, I would say that that is another example of how we have to live in harmony. We are created with good bacteria in our body. We don't wipe them out. So antibiotics, so don't use unnecessarily. Don't use unscrupulously. Just don't keep on thinking antibiotic is a solution. It's not a solution. Solution is to live in harmony with what we have and to use natural substances, get rid of the invaders or those pathogenic and those disease-causing bacteria, but not everyone. Don't use carpet bombing on our own body. So harmony with nature, harmony with the people around us, with the world, and harmony with our body. And eventually, and the other thing is, as Ms. Nicholas Tan said, if we live, we also have got to have a clean heart. We have to feel good about ourselves, and we have to have a good feelings about people around us. We should control our temper. We should meditate. We should do prayers. When we are calmed down like that, our body produces a lot of nitric oxide, and it will be beneficial. But if we engage in a lot of things, jealousy, rage, and also we are nursing hatred and anger all the time, it's proven our nitric oxide production as well as level will go down, and that is very damaging to our health. So nitric oxide, at least when we realize the science and we take the supplement, we boost it by being a good person, good individual, with nature, with people around us, with God, with environment. Then I think that there's nothing better than realizing that. And I thank God every day for what I've experienced so far, and for giving me the opportunity. And also, apart from that, getting me is not a coincidence. When I grow older and the first pathway is not functioning as well anymore, then I get to know what my grandmother has proposed last time, which is
wow.
Wow.
Thank you so much, Doctor. You are not.
I have to apologize for this poor connection and poor picture.
Yeah, but despite that, so thankful because you are also philosophical, and the importance of talking about harmony, yeah, with nature and with
Yeah.
one another. I think that's so important. Thank you so much, and thank you everybody for listening in. And thank you once again, Dr. Azman. Really appreciate your time, despite being Puasa month. You've taken this wonderful time to share with everybody. And last but not least, I just want to share one small announcement for everybody. Since we talk about nitric oxide, you know, today, tomorrow, and Tuesday, if you go out and share with somebody, and the person sign up with a builder pack and above, you as the enroller will get 1 bottle of Nitro FX. Yeah, isn't that wonderful? Wow. Wow. Let me share with you the screen, and we will actually blast it out later today. Yeah. So this is what you get. Yeah, just share. And thanks to Dr. Azman, he's talked so much about nitro and how the nitrates and nitrites pathway will help you. So go and help somebody. And I think we have this wonderful mission in life. Yeah, I think this is so important in line with what Dr. Azman talked about, to bring hope, the promise of a better life through wellness and opportunity. So let's go out, everybody. Thanks again for listening. Thanks again, Dr. Azman. Really appreciate what you have shared today. Yeah, thank you, everybody. Thank you so much.